Well, this afternoon, we keep our tabs on the spread of COVID-19. It's so everywhere. It is so everywhere in the world. But in Ghana, our situation is worsening by the day recently. New figures show another surge. Well, those are our new figures, as you can see there. This is for January 16th to January 16th. The new cases, 366. That's as of January 16th. The active cases, 2,174. Now check this out. Out of the 2,174, there are critical cases. And of course, there are mild cases as well. The critical cases we're looking at 36. Previously, it was just 13. And the severe cases are 98. So critical and severe, though gradually 98, hopefully it doesn't move into critical, but we're looking at critical cases 36 and severe 98, and that's a lot, 92% increase over the past few days. I was telling you about our COVID cases. Well, while the cases continue to rise, Dr. Anifi Asamoah, who is the Presidential Coordinator of Government of Ghana's COVID-19 Response Program and former Deputy Director General of the World Health Organization, has issued another warning. He says the country lacks adequate manpower to deal with the situation if it continues to escalate the way it is going. He was speaking at the 72nd Annual New Year School in Accra yesterday. Manuel Kranting visited the Nyaho Clinic also, which announced yesterday that it was turning its full attention to COVID and turning away patients who attended ailments other than, who came in with ailments other than COVID-19. Manuel will be joining me via Zoom, but I believe we can hear from the Dr. Anifi now. Right, let's get on to Zoom. Manuel Kranting is joining me. Hello, Manuel.
Yes, Gifty.
Manuel, let's start with what you found on your rounds.
So, like you said earlier, the Nyaho Medical Centre on 18th of January 2020 released a statement. In fact, that statement we were told was an internal memo directed at its internal staff, and essentially was given an indication that they were now cutting down on all their other services and focusing only on COVID-19. Well, my visit there this morning revealed that this particular directive has actually been reviewed, in that, yes, because of congestion and the sort of pressure that the request for medical attention is putting on the facility, they are having to, yes, cut down on a few of their services, but they have not cut down on all the services like was circulated on social media earlier. In fact, their business update on their website mentions that, and I'll read a bit of that to you, that due to the increasing number of cases in Accra specifically, we continue to make decisions at the center on a real-time basis to ensure patient safety and quality care. This might mean referring selected cases to other facilities from time to time. That means that for some of the not so critical cases, never mind even if they are not COVID-19, they'll have to refer some of them to other referral facilities so that they're able to concentrate on COVID-19. But they have not ended all non-COVID related services. They are still rendering those services, except that it's been scaled down a bit, Gifty.
And Manuel, did you get the chance to take a look at the facility yourself? Are you able to confirm with the congestion we're talking about here?
Yes, so the facility has, a restricted area where COVID patients are kept, and that is a no-go area for people who have not been admitted on the account of COVID-19. And so for that area, you're not able to go there. But I was told, in fact, by one of the officials there who took me around to observe the facility, that that particular area has been just restricted from the public, where you have other areas in the facility also, where they receive non-COVID related services. So yes, you're seeing, and you feel the congestion. In fact, at the premises of the facility, the Nyaho Medical Centre, you see vehicles moving in and coming out. And in the about an hour that I was there, I could count up to more than 200 people who had come to take COVID test and move away from the facility and so on and so forth. So you're having a real sense of the pressure that the facility is having to go under due to the surging cases of COVID-19, particularly in Accra, which we're told is the epicenter.
Did this official that you spoke to, was he able to share his own, thoughts or emotions with you about what the health workers there themselves are experiencing?
And one thing which was not lost on any of the officials that I spoke to at the facility was the fact that the education must keep going on, because for they themselves, even the health officials there who are rendering the service, they seem to be inundated with the work, so much pressure on them, some of them having to take extra hours to be able to provide care for the patients who are on admission there. And so they're trumpeting, as it were, the need for people to wear the face mask when they go out and stick to all the other COVID-19 protocols, just so that they can keep themselves safe, and for them at the facility also, they can take a breather from the pressure that they seem to be going through.
Manuel, thank you. Manuel Kranting there, who has been out and about checking out the situation at the Nyaho clinic, where they have issued a statement saying that they are turning away. They want to focus on persons who have been infected by COVID-19, and so the airport branch has been essentially restricted for that cases. It just tells you the number of cases they're having to deal with and how the numbers keep surging.